The Department of Internal Medicine offers our residents a 4-year training program through which they develop invaluable skills. They learn how to effectively treat patients in a number of conditions, and they also learn how to evaluate and investigate patients with the cost benefit in mind. This is done with the help of our faculty who train our residents intensely through the 4 years. There are several models of evaluation that we have available here. This is both work-based assessments, exams, final exams, and also mini clinical examinations which occur on a daily basis. We have a really good breadth of faculty who have experiences from around the world and impart this on our residents. And after the 4 years, we are very confident that our residents are able to manage any internal medicine service in any hospital, we feel worldwide as well. We have all the major specialties of medicine included in our department. That is, for example, cardiology, oncology, hematology, pulmonology, nephrology, infectious diseases, and several more. We have the largest number of residents, and we strive to make sure that our residents live here with excellent knowledge and skills to serve the population of Kenya and East Africa. The residents who graduate from our program in the years since this residency program began have gone on to do amazing things, not only locally but internationally. Our graduates are highly sought after in hospitals around Kenya, and the reason for this is because of their solid training, which makes them good all-round physicians. So there are opportunities to work in any public-private hospital in Kenya. There is fellowship programs that we have developed in our department, which are also open to our residents who graduate from here. We have several of our residents also undertaking their MRCP examinations in conjunction with their residency program. And this not only gives them the Masters of Medicine, but also an MRCP diploma as they finish their residency program, which makes them more sought after and marketable. We have connections with our sister university in Karachi, where we have sent several of our residents to do fellowship programs there, in addition to several programs in North America. So the opportunities after finishing residency with the Department of Internal Medicine actually remain limitless, and our department strives to make sure our residents who graduate from here have job opportunities, and we assist them in any way possible.
I'm a third-year resident in the Department of Internal Medicine. The reason why I joined Aga Khan's Medical College is because of the geographical preference. I wanted somewhere that is close to home. Other than that, I had the privilege of being in close contact with an alumni of this institute, and he shaped my perspective of the university, and I wanted to emulate him, so that's why I joined. The application process was smooth. It was an online application, and it was a stepwise approach, so it made it quite easy to apply.
The Department of Internal Medicine also feel like a family. We have several social activities that we include our residents in. Notably, we've had tree planting activities at Korora Forest. We have a Department of Medicine annual party, which is also with all our residents, where we get together informally. We have several conferences that we attend together with our residents. We also have team building activities that we undertake from time to time. There is also access to the gym at the Aga Khan Sports Club, which is available to all residents, including those in internal medicine.
The residency program in itself is quite challenging, and it's time consuming. So you have to learn to create time for yourself, to rest, to sleep, to catch up with your friends and family, because all this is important in making sure that you have a good mental health.